on public health will come to order. Will the clerk please take roll for today's attendance?
Chair Green.
Present.
Representative Kuhn. Representative Maddox. Representative Slaw.
Present.
Representative Steele.
Here.
Representative Price.
Here.
Representative O'Neill.
Present.
Mr. Chair, you have a quorum.
Thank you. And Representative Steele makes the motion to approve the April 15, 2025 minutes. There being no objections, minutes are approved. And at this time, we'll get into our presentations, into our work for the day. And I'd like to ask Sydney Brown, either from here or from, go down there, to give us an overview from House Fiscal regarding this area of the budget. So Sydney, when you are ready, we'll let you run.
Good morning, Mr. Chair, members of the committee. Sydney Brown, House Fiscal. I'm just going to give a brief overview of the main lines that the presentation today will touch on. A copy of this document is at the desk with you, and that's what I will primarily be reading off of. So the first program or line that will be discussed today is the Childhood Lead Program that has 4.5 approved FTEs, authorized FTEs, with a gross of $2.3 million, which is also has $645,900 general fund. This line is supporting costs for FTE positions and contracts for services to prevent lead poisoning in children, screening for abnormal blood lead levels, lead hazard identification, outreach, public provider education, and technical assistance. In case anyone's wondering, an elevated blood lead level is above 3.5 micrograms per deciliter, and that's as much science as I do. The funding for this line is mainly allocated to the local health departments, primarily in Detroit and high incidence counties. There's about, from my research, there's about 12 counties being served from this line currently, including the Michigan Public Health Institute. In the current year, in fiscal year 24-25, about $914,200 gross, $183,500 general fund has been spent. Moving on to the Healthy Homes Program, this line has 66 authorized FTEs, $56.6 million gross, $35 million general fund. This supports FTE positions, related costs, and contracts for home-based intervention programs to reduce child lead poisoning, asthma, and unintended injuries caused by lead abatement or lead, the word I can't think of, being exposed to lead, there we go. Lead hazards in older homes and lead-poisoned children, local oversight, certification of individuals that perform lead abatement, and lead hazard remediation and training. The funding is typically allocated to local health departments and vendors through contracts to do that work of lead remediation in homes. In the current fiscal year, $22.5 million gross, $14.4 million general fund has been spent. From my research, there's been about 14 counties served out of the Healthy Homes line, including the Michigan Public Health Institute. Lastly, there is the PFAS and Environmental Contamination Response line. This has 43 authorized FTEs, $19.5 million general fund. This is an all general fund line. This is funding for FTE positions and related costs for contracts for the public health response to contamination of PFAS in drinking water and the environment. This also supports PFAS laboratory testing and analysis and environmental health toxicology chemical analysis outreach and response. Funding is allocated to vendors through contracts. There is additional funding for PFAS in the local health department area, which is Section 115. In the current fiscal year, $7.7 million general fund has been spent.
All right, thank you, Ms. Sidney. Question for you. As we look at this, the funding models, how much is grants from the feds? How much is federal like grant as in you get this amount? And then are there federal drawdowns where it's a 3-to-1, 5-to-1, 10-to-1, as we look at those dollars?
For the Healthy Homes line, I believe there is a federal fund that requires 25% match. For the childhood-led program and the PFAS environmental contamination response, obviously in the PFAS environmental and contamination response, there is no federal. That's all general fund. For the childhood-led program, there is federal, and I would have to check for you about the match requirements for that.
If there is a match or which, okay. Representative Steele?
Thank you, Chair. Thanks, Sydney, for that report. When we refer to contracts, I always think, how many contracts? How many people are they actually helping? And I know that is probably just not in your scope of work. Maybe DHHS can answer that. I'm not sure. But I'm just always wondering is like we've put all this money forward, how many people are we actually helping? And it's always this much administration and that much help. So if
I cannot go down as far in my tracking software to see exactly how many people. I think that would be more in the department's purview to give you an answer for that. But I can see how many counties payments have gone out to. I can see how much money has been spent so far, but I can't see those numbers.
Can you see the actual number of contracts?
Representative Maddock?
Thank you, Mr. Chair. I love Grok. It's so awesome. I just asked Grok, what specific disease does PFAS cause? And you know what the answer was? Based on current research, no single disease is definitively caused by PFAS alone. Isn't that interesting? So we're making all these conjectures about PFAS and it causes this and that and this and that. We're spending billions and billions of dollars.
Representative, can you ask that to our DHHS? This is the House Physical.
Yeah, okay, you know your question. Thank you.
I can tell you because I did get a sneak peek of this presentation. This is that is mentioned, so stay tuned.
Representative Slaw?
Thank you, Chair. So my question, as you were going through the the childhood-led program and then the healthy home-led program, there seems to be like there could be some overlap in those programs, and and then that we've only got 12 counties in childhood-led program, 14 counties that were paying dollars to the healthy home side. It strikes me as there ought to be, I don't understand why we're not having those same kind of issues in other housing stock across the state, and why is it that we're only funding that into 14 counties or 12 counties as the case might be? Yeah, can you help me with thinking about that?
I think that might be something that the department would be better able to answer. The 12 to 14 counties that I identified is just what money has been obligated so far. So if I check that software later on, there might be 20 counties, 25. So this is just what's happening, what I can see so far.
Okay. So you're thinking that the health department, DHHS is really the answer to that question?
I think so. I would think so.
Okay.
Yeah.
Are they the same counties?
Are those 12 and 14 the same counties? Or is there, what kind of overlap is there in those two?
The city of Detroit receives funding from both. Kalamazoo County receives funding from both. I think that's Jackson County. Jackson County receives funding from both. And I think that's it, from what I can see.
All right, thank you, Sydney. And just for those of you in this room, my understanding is there might be some maintenance going on. And so if you hear really weird knocking noises, that's a maintenance issue. That's not the sound system getting ready to, do something crazy. So What's that? It's not the world coming to an end. That was 1984. But that's that. All right, we're going to move forward with the department. Many of these questions were with the department. I'd like to introduce and turn over the meeting for a presentation to Dr. James Bell, the State Assistant Administrator, and we're looking forward to his presentation. I believe, members, you have a hard copy in front of you, as well as up here on the sides. So, Dr. Bell, thank you so much for being here today.
Thank you so much, and good morning, Chair Green and members of the committee. As mentioned, my name is Dr. James Bell III. I am the Chief of Staff for the Public Health Administration within the Michigan Department of Health and Human Services. I'm here today on behalf of Dr. Sarah Callow, the Senior Deputy Director, who planned to testify today but is currently attending to an urgent family matter. I appreciate the opportunity to speak with you in her place and to share MDHHS's perspective on some critical environmental health topics. Environmental health refers to the branch of public health focused on how our environment, the air, water, soil, and food, and the built environment affects human health and human well-being. It involves identifying and reducing risk from pollutants, hazardous materials, and unsafe conditions, all to ensure healthy communities. Here we're highlighting a few of our programs aimed at addressing environmental health concerns. We know that chemicals don't stop at district lines or stay in specific neighborhoods. We have supported people who have PFAS in their drinking water who live in $500,000 homes and in $50,000 homes. Wildfire smoke affected everyone last summer. We supported schools and summer camps in determining if it was safe for children to play outside. Michigan and other Great Lakes states promote fishing and hunting as a primary outdoor activity, yet we all have contaminants identified in our fish and game. We work together to ensure that people are informed about what they are eating so they can make their own choices for themselves and their families. And when concerns come up that we haven't yet addressed, people can call us directly and speak with a highly trained toxicologist. We help them understand which hazards they should be concerned about, and more importantly, what steps they can take to protect themselves and the people they love. So here's a quick overview of what I will be covering today. We'll start with PFAS and discuss how MDHHS is working to respond to growing concerns around exposure, health risks, and community awareness. Next, I'll highlight our ongoing efforts to prevent childhood lead poisoning. This includes education, testing, and outreach focused on protecting the most vulnerable members of our communities. And from there, we'll look at how we're creating safer living environments through lead abatement and home interventions, especially in older housing stock where risks remain high. Finally, we'll wrap up with a look at our long-term vision, what it will take to fully eliminate childhood lead exposure, and the role that policy, partnerships, and prevention all play in getting us there. Per and polyfluoroalkyl substances, or PFAS contamination, is a threat to human health. MDHHS has characterized people's exposure to PFAS from multiple sources, including the water they drink and the fish and wild game they eat, as well as other less common PFAS sources like beef, produce, and foam on water bodies. As you can see in this map, PFAS is found throughout the state, and these are just the known sites as of last week. Approximately 4 new sites are added every month to the official MPART list. MPART is the Michigan PFAS Action Response Team, led by EGLE, but is a partnership of several state agencies, including MDHHS. Not shown on this map are the more than 400 other sites where MDHHS is responding to one-off uses of PFAS that were not large enough to make EGLE's list, but the impact of use still may affect human health, including using PFAS-containing foam to put out a fire near the GM Proving Grounds in Milford and in Menominee during a warehouse fire. Epidemiological studies are critical when it comes to assessing harm from contaminants because we cannot directly test these chemicals on humans, and an epidemiological study allows us to look at the contaminant in real-world conditions with real people who have been exposed to this hazardous chemical so that we can make real public health determinations. However, we do know that humans should not be exposed to industrial contaminants in their drinking water they otherwise would consider safe. MDHHS has conducted over 7,000 blood tests for PFAS from over 4,000 people in Michigan. We now better understand the relationship between water levels and blood levels of PFAS in real Michiganders, and we have demonstrated how quickly blood levels go down after interventions to provide clean water. In that population, we have so far seen a 38% reduction in PFAS in their blood in a very short amount of time. demonstrating that our affordable intervention of providing filters in homes, stopping exposures at the drinking water tap has been effective. PFAS is considered an emerging contaminant because the body of science is not fully developed with regard to the human health effects that are linked to exposure. The body of knowledge is fairly limited to types of PFAS. The CDC's multi-site study looking at 9 PFAS, the famous C8 study in Virginia assessed just 4, but MDHHS is assessing 45 different PFAS in health studies, looking for correlations that have otherwise been undetected when comparing PFAS exposures to human health impacts. PFAS exposure in laboratory animals causes changes in immune response, serum lipids, liver damage, and tumors in multiple organs. From epidemiological studies of humans, we have the understanding that PFAS has been linked to the immune system impairment, thyroid disease, liver damage, multiple cancers, including kidney, testicular, and liver cancer in humans, increased cholesterol, and lower birth weights, my apologies. PFAS can result in these diseases and has demonstrated as a causality in animal studies. Over time, as we gather more data through our epidemiology studies, we'll be better positioned to make clearer determinations about health outcomes. That said, because companies don't conduct clinical trials on industrial contaminants as they would for medications, establishing direct causality between exposure and disease is inherently more complex. While Eagle is sampling monitoring wells, looking for plumes and industries they can hold accountable, we are sampling and analyzing water at the tap adjacent to that environmental contamination, what people are actually being exposed to, and then we act to prevent further exposure by providing education and certified filters. We're also testing fish and wild game to ensure that people have awareness of what they are eating and how much they can choose to eat without exceeding any current lifetime screening levels of PFAS. As a true public health emergency related to PFAS in 2018, Parchment, Michigan was identified through Eagle's municipal water sampling program to have PFAS levels above the EPA's lifetime health advisory level of, at that time, 70 parts per trillion PFAS or PFOA. While Eagle notified the water plant that their water was not potable, MDHHS went into action with local health departments providing same-day notification to the people in the community, with local health departments providing same-day notification, sorry, I'm repeating myself, same-day notification to the people in the community, with local health holding the authority to order do not drink water advisories and MDHHS looking for an alternative water source. In less than 24 hours, MDHHS had purchased and provided several semi-trucks worth of bottled water to the people of Parchment, therefore ending their exposure. In a short amount of time after that, MDHHS was then able to procure certified filters and have them installed in homes while the city worked to connect a water pipeline from neighboring Kalamazoo.
Doc, can we stop there?
Yes.
That seems to be sort of the end of the PFAS, right?
Yes.
So a couple questions, and then maybe if some of my others would as well. So what you're saying is because this is an emerging contaminant, this is not something where the body of science has been completely wrapped our brains around. So I'm thinking of like the 1950s, as there was Superfund sites and waste, and now we are reacting on the backside of a lot of that. With the PFAS, we're trying to get out in front of it. Is that the concept?
Yes. So our goal here is to ensure that as we know PFAS exists, we want to start to respond to it in a way that gets ahead of the long-term implications. As our studies show right now, it is not impacting humans in the same way because the body of science is not there. But what we've seen in animals, we can start to make inferences about what is possible.
Okay, and then the concept of the blood tests. I sort of like nice, clean, filtered blood. I like to let my body sort of work through the process that it was designed to do. So what you are saying through our tests is that we are identifying through blood tests that there is PFAS, and all the other iterations that are getting into our bloodstream, so that it's sort of bypassing our liver and kidney filtering system. Am I correct with that?
Yes.
Okay. Other questions on the PFAS? Representative Maddock.
Thank you, Mr. Chair. Dr. Bell, do you have any education in environmental science, chemistry, biology, or toxicology?
No, I do not.
Could you tell us about your education?
I'm a social worker by training.
Okay. Someone once told me that at 1 part per trillion, we have the technology to detect elements and compounds at like 1 part per zillion now. Is it true that you can detect PFAS in a water bottle or a styrofoam cup?
I would trust my environmental health colleagues to respond to that.
Okay. You heard my earlier question about how I asked Grok whether or not PFAS causes any diseases, and the answer was, based on current research, no single disease is definitively caused by PFAS alone. Can you explain that?
From my understanding and what's been shared with me, disease occurs based on 4 factors coming together. And so that is who you are, aka your genetics, the life that you've lived, your current health status, in addition to agents in your environment. I am not in a position to say that any of these diseases are caused by PFAS. What I can share is the interpretations based on what we've seen in animal studies.
I mean, if you're sitting here listening to this presentation, you would certainly come to the conclusion that PFAS causes all these diseases. Am I not correct?
I am saying that PFAS is a hazardous man-made chemical that should not exist in Michigan's drinking, food, or people, but it does.
And how is it hazardous?
It is a known hazardous chemical. Toxin is what we've observed through those animal studies.
Who defined it as a hazardous toxin?
I would need to take that back to the department to give you a clarified answer.
Okay, Representative.
Thank you.
We have, okay. Representative Price?
Yes. Hello. Thank you for being here with us today and for speaking from your perspective from the department. I mean, there's no question whether or not PFAS provides a risk to Michiganders. I think all of our experts in this area agree. I'm concerned, we learned earlier this month, or actually last month, I'm sorry, it's early in this month, that the current EPA is reversing bans on hundreds of highly toxic PFAS forever chemicals and other dangerous compounds in consumer goods. If this happens, what could be the impact on the measures that Michigan has put in place to minimize health risks for Michiganders?
Thank you for the question. My assumption, and I would want to confirm with our team back at the department, is that we would want to strengthen those current factors that we use as far as identifying risk. I know that the metrics that we're using to track right now are sufficient, but if we are losing individuals, funding, institutional knowledge from our federal partners, I would imagine that that would trickle its way down to our local communities.
Representative Steele?
Thank you for your presentation. And you gave one indication of Parchment helping them out. Do you know how, back to my question earlier, how many specific people have we helped with this funding? And I see one instance, but how many other instances that we helped with that funding? And I, just to go in, plastic is another concern in our environment and our water. And so when I see all these water bottles, I think about all the plastic that we're intaking with the microplastics in our water stream, in our environment, in our landfills. And are you doing any studies on the plastics and the parts per million, billions in our body? And when I see that this is a fix, I think that this is going in the opposite direction of where we need to go.
Thank you, Rep. Steele. I can answer the prior question first. I'm a lot more confident in that answer. The things that I want to highlight, we've distributed over 3,000 filters. Over 7,500 homes have been sampled by DHHS sanitarians. We've held 750 events, including health fairs, town halls, and have touched on 7,000 residents through those activities. The second question that you've asked, I want to make sure that I get the right answer back to you.
Yeah. So as a society, I think we're in this weird situation where we are learning about the PFAS and the microplastics, yet our water, many times our clean water is distributed through a plastic bottle. And so definitely, I go back to 2019 when I came into the legislature, and this was sort of emerging at that point. So it's really only been 6-7 years and a lot of ramifications. So Representative Steele?
7,000 residents who have attended events, including health fairs and town halls. Yes.
And that
Yes.
All right, let's continue on with lead now. Thank you.
Sure thing. So next, I want to take a closer look at lead prevention in our state. Per the CDC, there is no safe level of lead in blood. Exposure to lead affects nearly every system and organ in the human body, but children are at a particular risk because it interferes with their nervous system development. Lead exposure is linked to lower IQ scores, behavior and attention problems, and hearing problems in children. It affects kidney function in both children and adults, as well as affecting adult cognitive function, moods and behaviors, blood pressure, and reaction times. Lead is a widespread issue. Children with elevated blood lead levels can be found throughout the state. These gray boxes you see on the map represent locations where not enough children have been tested and identified as an EBLL case to provide a case count large enough to protect their individual identity. This map shows the percent of children who have been tested in FY24 and were found to have an elevated blood lead level. And currently, only 21% of the population under 6 years old has actually had the opportunity to be tested. Michigan's new universal child blood lead testing law requires all children ages 1 year and 2 years to be tested for lead. These ages are targeted because of kids' frequent hand-to-mouth behavior at these ages, leading them to be more susceptible to accidentally eating lead dust or paint chips. There are 82 high-risk communities in Michigan. MDHHS is identifying communities at high risk using data from blood lead test results and population-based data on pre-1978 housing, poverty, and other demographic factors known to be associated with increased lead exposure risks. These high-risk communities include our faucet and filter safety net communities and our filter safety net communities where families at risk get access to free filters and faucet replacement when lead is detected in their drinking water. Children in all 82 communities are considered high risk for lead exposure and therefore should be tested for lead in blood under the new universal testing requirements at age 4. Intensive education on universal testing requirements will occur in all 82 communities where children are considered high risk. Currently, testing a child's blood is the only way to confirm if a child has a current or ongoing lead exposure. Prior to universal testing law going into effect in FY24, about 141,000 of 670,000, or about 21% of children in Michigan had their blood tested for lead. 4% of the tested children had elevated blood lead levels. The percentage of children tested varies widely from county to county. The hope is that universal testing will ensure that all children have the opportunity for a lead test so that they can be identified early and their exposure stopped to limit the harm that it may cause. When a child is identified with a lead exposure, their family receives an educational mailing from MDHHS, and all are referred to local public health and encouraged to accept available case management assistance. In FY24, all 5,830 children's families received this notice. To receive case management, Medicaid requires an elevated lead test from a confirmatory venous blood draw. For many families, getting to a hospital lab can be a barrier, as not all children with elevated capillary tests completed a venous draw. However, even when qualified, families can still choose to not accept case management, and despite the services it unlocks, and some do choose to not participate. However, in FY24, the families of a total of 860 children opted to choose case management supports, which MDHHS provides through the Childhood Lead Poisoning Prevention Program. A primary source of lead exposure for most children is their home. Homes built before 1978 can have lead paint, plumbing installed before 1986, and faucets manufactured before 2014 could have used high amounts of lead. As those homes and plumbing deteriorate, they put lead into the environment that can get into those living in the home, putting children and fetuses at risk. Preventing lead from getting into children is essential to allowing our Michigan children to be successful in school and in life. For over 25 years, MDHHS has held the authority delegated from the federal government to the state to uphold lead laws in Michigan. This includes conducting lead inspections, conducting and overseeing lead abatement to ensure safe lead construction practices, and certifying professionals in lead abatement. MDHHS and our Childhood Lead Poisoning Prevention Program are working to end lead poisoning of our state's children. Until lead can be completely removed from all home environments, MDHHS has implemented statewide lead education campaigns, including the Lead is an Invisible Threat campaign that speaks to the importance of getting a lead inspection if you live in a home built before 1978 due to greater risk of lead paint, as well as the importance of identifying other lead hazards that may be in your home. In November 2023, MDHHS announced the Get Ahead of Lead strategy to protect families most at risk of lead's harmful effects, which include a statewide recommendation that people use a certified lead-reducing drinking water filter if they have or are uncertain about their home having lead or galvanized plumbing, a lead service line carrying water from the street to their residence, or old faucets and fittings that were sold before 2014. And MDHHS also continues to run safety net programs that are providing filters and providing lead-free faucets to those who can't afford them in high-risk communities throughout Michigan through our faucet and filter safety net and point-of-use filters to those who qualify for our filter safety net program. This includes nearly 3,400 foster homes statewide as MDHHS works to ensure we're keeping Michigan's most vulnerable children safe. In FY 2024, MDHHS abated 349 homes, creating safe, lead-free home environments for nearly 830 children to grow and thrive in Michigan, and we have many more to go. We recently also launched a new program with Medicaid that no longer relies on a child being poisoned by lead in order to initiate prevention services. Beginning in 2017, any home containing lead paint or plumbing that houses a child or pregnant person on Medicaid may be eligible for lead abatement services prior to poisoning taking place. MDHHS also oversees the Lead Hazard Control Community Development Program, which began in FY18 and empowers organizations to oversee and support lead abatement efforts and lead prevention education in their own communities. And as we've seen today, whether it's PFAS, lead in homes, or broader environmental health challenges, our work is fundamentally about prevention, protection, and persistence. The good news is we know what works: identifying risk early, eliminating exposures, and supporting families and communities with the resources they need to stay safe and healthy. Thank you for your time and your continued partnership in building healthier, safer communities for everyone.
Thank you, Doctor. A lot of information here. Trying to figure out some workings here. MDHHS has a staff which operates the lead removal program. Am I correct with that?
Yes, that is correct.
And then we also have contractors working with the working around the state. And then I think there's a third group of the nonprofit agencies that are doing some of the same or similar work with entirely different teams. Can you draw me that picture and how they interact with each other and why all three are needed and not just doing it one way?
Sure. There's opportunities for relationship building on all sides. I think the relationship that we have with our nonprofit partners as well as our local partners, contractors who may be more attracted to opportunities that are more cost, the state is able to quickly identify those homes and ensure that we can deploy individuals to where they need to go. I think it's also the relationship that's built between those nonprofits that tell us exactly what's happening that we might not be able to see. I can speak to the fact that we have a lead stakeholder group that pulls together all of those entities together to have open communication to see where those opportunities and gaps are.
I guess, and then sort of one more, on my side, one more question looking at patterns. Page 5, which would be your childhood lead poisoning prevention program, that slide right there. Looking at that, I see some dangerous areas: western UP, southern Lower Peninsula, but then as well, I'm looking at where Saginaw is, where Flint is, where Detroit is, some of those population centers. And I'm very surprised to see Genesee County at 2.1, but at 2.1%. But then as well, it looks like there's some larger issues in western Michigan and in truly southern Michigan across that two southern tier counties. Can you talk a little bit about what you are seeing in relation to this map?
I wish I could speak more to the specifics of these patterns. What I can reiterate is that lead is a widespread issue. And as you can see within the map, that there's certain areas where you do see those greater rates. I know that we spend a lot more time in those communities, making sure that people are informed about what type of hazards and risks are in their communities. I think it's also a matter of making sure that people are aware that the department is also present, trying to have those conversations, doing a lot of local outreach, a lot of community engagement, but also supplying resources when available.
And then I guess my last question would be, is we're looking at private homes, we're looking at individuals. How is this a core function of the government when we're dealing with private property?
That's a great question. The reason public funds are used is because this is not a private issue. When a child is exposed to lead, the long-term costs don't stay with the property owner. It shows up in special education, it shows up in the workforce, it shows up in healthcare costs, and it becomes a public burden. So I believe that investing in known interventions now is a cost-effective way to prevent long-term, more expensive consequences. And so while the intervention may happen on a private property, the return on investment is very much public.
All right, thank you. Representative Price?
Thank you, Chair. And thank you for that important perspective. We know that when we are able to prevent the harm on our kids, it's not only the right thing to do, but it's the fiscally responsible thing to do as well. So my question, I'm grateful for that universal child blood lead testing law that we passed. We know this is best practices to be aware and to keep our kids safe. How much does a lead screening cost? And a follow-up, considering now that we're doing the universal testing and we're just aware of more issues because we're testing it, is the current funding level sufficient to meet those testing and treatment needs?
I want to get back to you on the cost of a lead screening. What I can share is that being a part of the universal testing work group, we've identified that we are not at capacity right now to respond, but we are working closely, again, as you mentioned, with our partners, making sure local health departments are informed of what's available to them, making sure that we have the most up-to-date information that we can share, in addition to working with our pediatric community.
Representative Maddock?
Thank you, Mr. Chair. What's more dangerous, lead or PFAS?
As I described previously, I'm not an environmental specialist, but I would say that both are hazardous to individuals. I can't say that one is more dangerous than the other.
Okay, thank you.
Representative Steele?
Thank you. I'm just comparing the numbers from fiscal and your report, and being that we are in a sub-budget committee, I always look at the numbers. So I see that on page 13, you provided help to a total of 1,600 homes. However, if I add up the cost for lead base, it's, 23 million. And so if I divide the two, it's $14,000 per house that we remediated. I mean, I know it's, broad, but is that what we're helping, is just those 1,600 homes at that cost per home? And the same thing with the PFAS. If you take those numbers, it ends up being $2,500 per filter. So I'm just wondering if I'm even close to being able to compare these numbers.
Sure. I think I can answer part of your question. And so in preparing for this presentation, I learned a lot about the cost of lead abatement. And the average cost of a home being abated is around $54,000. And so your numbers, though accurate as far as the way that you did your division, I think it's additional costs that we're not considering. I think that when we talk about abatement, one would assume that we're just looking at the paint. We actually go into communities and find out that people need new roofs. We find out that there's infrastructure that is damaged as well. I think it becomes a broader question around how do we support communities right now to ensure that a family has a home tonight, as opposed to just quick fixes. And I realize that takes a lot more time and it costs a lot more. So I want to say over the last 20, 30 years. So since 1997, we've abated over 5,000 homes. Just last year, it was 350. I think what we're also learning is that as we're doing our inspections, we're starting to identify more and more problems that actually exceed what we're able to do through our current funding. And I wish I could answer your question on PFAS, but I don't know the answer.
And so basically, you're going in to remediate the lead, and then you're actually doing other repairs on the homes?
In some cases, not all.
Okay, Representative O'Neill.
Thank you, Mr. Chair. Thank you, Dr. Bell, for your presentation. Just a general question in terms of what percentage of federal dollars are associated with our ability to provide these essential services?
I do not have the answer, but we can get that to you.
Thank you, Mr. Chair.
Representative Slaw.
Thank you, Chair. So, Dr. Bell, can you give me if we don't find infrastructure problems like the houses falling in or the roofs are caving in or whatever, what does abatement of a home look like from a lead perspective?
I wish I could give you the technical details. My understanding is that they spend a lot of time, one, going through the paint, also looking into where there may be other sources of lead. And so I know we spend a lot of time talking about paint and water, but there are also other sources. So make sure that people are educated as far as what all risks are. The abatement, let me get back to you on the details. I want to make sure that I paint the picture correctly for you. Yep.
Representative Maddock, again.
Talking about lead abatement and the department's program involving lead abatement and controlling that, is there anyone in the department currently employed in the department who has a relative in the lead abatement business? And is there any conflict of interest with any lead abatement contracts that you're aware of?
Not that I'm aware of.
Thank you.
All right, thank you, Dr. Bell. Appreciate on short notice being tossed into this presentation, and appreciate your knowledge on that. Representative Slaw moves to excuse absent members. Seeing no objection, motion passed. And there being no further business, the meeting is now adjourned.